Thinking of brightening up your smile? Well, don't know where to start? Advice on when you can use over-the-counter whiteners and when it is time for the professionals to step in and help you out. 8:12 is the time. You're watching Fox 45 Morning News, all local, all morning. 8:15 on this Monday morning. If you want a brighter smile and you're not sure about what products are best for you, well, Dr. Kira Evans from the Dental Care of Baltimore is here to compare over-the-counter whiteners and then having your teeth whitened professionally. And thank you so much for coming in.
Hi, thank you for having me.
Your whole life is looking at people's teeth, right?
Absolutely.
And you, I'm sure, hear of different ways that people are whitening their teeth, from home remedies all the way through something that comes through your office. Let's start with the new ways that people are whitening teeth.
Absolutely. So there's a lot of over-the-counter products out on the market, and toothpaste, even rinses and chewing gum. Right. Most of these have very low concentrations of one key ingredient, and that's hydrogen peroxide.
Okay.
But again, at about 3% concentration. So they're very safe if you use them properly according to the directions. They can lead to long-lasting results, and usually, typically, you want to use it for about 4 to 8 weeks before you see noticeable results. But again, use it according to the instructions.
And sparingly, too. I was just telling you, prom season's coming up, and a lot of people will sit there and they'll say, okay, it says use once a day or maybe twice a day, apply this twice a day, but then they'll over-concentrate it. They'll put it on their mouth 10 times a day just so they can get that whitener right before a prom or right before a wedding or some event that is coming up.
Right.
What does that do to your teeth and your enamel?
So hydrogen peroxide, if used not according to the instructions, can burn through your gums and cause cellular damage. Okay. It can also, like you said, penetrate the enamel and cause extreme tooth sensitivity. So it's really important to keep this in mind and pay attention to the instructions on the labels. Once
you start breaking down the gums, then that leads to a whole other issues with bacteria getting in there. Is that right? Absolutely,
especially if you're already starting with gum disease. You can lead to recession that's permanent and can't be corrected. So again, hydrogen peroxide, if used incorrectly, can cause a lot of damage to the teeth and the gums.
What is the most, I guess, popular way to whiten teeth when you go into professionally, when you go into an office?
So unlike the over-the-counter products, when you come into a dental office, we use strengths up to about 45% in some of the hydrogen peroxide. Because we are professionally trained and we apply barriers to the gums, we also provide desensitizing toothpaste to use after the procedures. So it can be very effective. In little as 60 minutes, you can achieve up to 10 shades whiter, again, because of the higher concentrations that we're using. But you have to be careful, and it has to be applied by a trained professional.
Okay. Well, and also the cost involved. It may seem expensive when you go to the dentist office, but then you have all those, I guess, precautionary measures where later on in life, if you've done damage to your teeth that was not professionally followed, you may be in the dentist chair a lot more paying for other things. Okay.
Exactly.
That's perfect. Well, coming up next hour, you're going to be back to talk to us about some other methods and the different types of shades, I guess, that we could have on whitening our teeth.
Yes, exactly.
Dr. Evans, thank you so much. We appreciate your time.